Many people associate arthritis with body aches, pains and stuff. Is it related?
So arthritis means, anytime the word itis generally means inflammation. See, it's not pain, it's inflammation.
So whenever there's like a tear or something damaged, right, then your immune system will go in and repair it, cause the inflammation.
Your body's immune system defends you, it protects you. Most of the time when you talk about immune system you're talking about infections. When we had COVID, was it the virus itself that's deadly? No, it's the body's response.
Because a lot of time when you go and see a doctor, or even our parents or our belief, how we were taught, whenever we have fever, first thing, take a Panadol.
Yes, when you have fever, when you have pain, we have powerful drugs that can bring down the temperature. But there's a big problem with this. What's causing it? Have you addressed the root cause? Autoimmune disorders tend to affect the younger, not the older age. Majority of my patients are between the ages of 20 to 45.
Oh, really?
Oh, wow. So young.
We talk about sitting too long, being too sedentary causes osteoarthritis. But at the same time, when we move too much, there's impact. Also, we cause osteoarthritis.
Correct. You have to understand, for a joint to be fully functional, the muscle must be also functional. And if we are sedentary all the time, what's going to happen to the muscle? The muscle is going to atrophy. It's just going to shrink. Every 20 minutes, for 20 seconds, look at a structure that's 20 feet away. That's the 20-20-20 rule.
Joint pain and body ache are just part of aging. Weather changes makes our joint hurt. Cracking the knuckles can cause arthritis. Women are more prone to arthritis than men.
Okay, so
Hey, what's up guys? Welcome back to another episode of the Entrepreneur's Journal. So these days, almost everyone complains about body ache, stiff neck, lower back pain, aching knees. So is it from the long hours sitting in front of our PC, the way we use our phone, bending our heads, or bad posture, or maybe doing vigorous activities? Or is our modern day habits silently wearing down our joints? Or are these everyday pains actually early signs of something deeper that's happening inside our bodies? Right. So in this episode, I'm joined with Professor Doctor Sargunan, a rheumatologist and also the head of rheumatology at University Malaya. And today we'll be talking about what's really going on when our body hurts, and how to tell the difference between normal pain and the warning signs, and what can we do to keep our bones and joint healthy and for the long run. Right. So welcome Dr.Guna to the show.
Okay. Welcome, Dr.Guna.
Okay, Stephen, Jean, thank you for having me. Thank you.
Yeah, it's glad to have you here. I'm really
pleasure.
looking forward for this conversation because body pain, like stiff neck, lower back, everybody has it. I had it for the longest time. Everybody I know has this issue, right?
Actually, I'm having it right now.
Yeah, right. Yeah. Even bodybuilders, young people, old people, everybody has it. My mom has it. My dad has it. My sister has it, right? So I had like neck pain for the longest time, and I forgot how does it feel to not have any neck pain. But speaking of body pain, which we're going to talk about in details later, many people associate arthritis with like body aches, right, and pains and stuff. Is it related? And we are talking about there's a couple of different types of arthritis: rheumatoid arthritis, osteoarthritis, or even osteoporosis. Are they all the same, or what is the difference between all of them?
Okay, so I think you've pretty much described, I think very poetically, I must say,
Really? Okay.
this entire concept of pain. And I think it's all, you're talking about pain.
Yeah, body
and there
pain.
are many types of pain, isn't it? So let me go by talking about arthritis. I mean, that's my area of specialty.
Okay.
I'm a rheumatologist. So rheumatology is the study of the diseases that affect the musculoskeletal system, but that is as part of a bigger spectrum of disorders.
Right.
And much of it is actually autoimmune. So I think we're going to talk about autoimmune.
Yeah, autoimmune.
The other element is degenerative. And if you look at the joint, the anatomy of the joint, you can always Google it and so on. I'm probably not going to have a blackboard to show you things and so on. But if you look at the anatomy of a joint, is where two bones come together and there's a range of movement. So it's got a capsule. So there are tissues in it. Now, what also happens is there are nerve endings in it. So these nerve endings are different types of nerve endings. One of it is called nociceptor. Nociceptor is your pain receptor. And the pain receptors are connected to the nervous system. And if that's triggered, the brain registers it as pain, right? So that is one part of the story. The other one is you mentioned arthritis. So arthritis means, anytime the word itis, I-T-I-S, generally means inflammation. conjunctivitis, uveitis, glossitis, iritis, otitis. So all these are different tissues. So the word itis comes there means there's inflammation. Not always, but most of the time. So arthritis, arthros, meaning joint, itis, that means it is inflammation of the joint. See, it's not pain. It's inflammation.
So inflammation is the one that causes the pain, right?
One of the components of inflammation is pain. So the next question is inflammation. What is inflammation? Why is something inflamed? So inflammation is how our body responds to any form of injury, stress. It can even be pressure. Let's say somebody slaps me, one slap goes there. That is a high impact already.
Yeah.
What's going to happen? Your face turns red, isn't it?
Yeah.
Why does it turn red? Because of the impact now, there's increased vascularity. There are more blood vessels going there. Why do you have blood vessels there? Because it goes immediately to try to repair the situation. So when there's blood vessels in, it becomes hot, it becomes red, and it becomes swollen. All right. And as a result of all the stretching, it becomes painful. So these are 4 components of inflammation.
Oh, I see.
One of it is pain. And in arthritis, inflammation of the joint, these things happen. There's increase in blood flow. There is also increase in the temperature. It becomes a bit warm. It swells up because there's now a lot of fluids collecting. And because of the stretch, there's pain. And ultimately, one of the other problems of inflammation is loss of function. Obviously, once you get an injury, there's loss of function. It doesn't work the way it should work, right? It's all part of the response of the body to try to fix something that has gone wrong.
I see.
So that is pain as a part of inflammation. Inflammation is arthritis. So arthritis means an inflammation of the joint. Your next question will be, what caused the arthritis? What causes it? And that's where we go into the number of things that can cause arthritis. The one I think you're talking about, the day-to-day experience, you mentioned that even now I'm experiencing pain, is usually mechanical. Obviously, let's say our bodies are very flexible. You see gymnastics, so the things they can do, amazing.
Yeah,
right?
Amazing.
But I ask you now to do a backflip, let alone the fact you're going to fall and crack part of your body, right? You're not prepared. You're suddenly stretching a part of your body that never stretched before, correct? We see people do it on the internet all the time, right?
Yeah, you never activate that part of the muscle.
Yeah,
before,
all these reels coming up and then you're so excited. I so want to do that. That's it. Because you're not prepared for it. You didn't do your warm-up. You didn't do your stretching exercises, right? You didn't study the what are the steps involved. And now, like a hero, we all go and stretch. Obviously, guaranteed, you're going to have a mechanical stretch, which need not be inflammation, need not be always. Sometimes it could just be structural pressure. You just create pressure. Like, if like I took my fist and went on your chest like that. Is that inflammation? No, but that's mechanical pressure. And it can be at some point be very painful. What are you going to do? You're going to push me away, right? That's not necessarily inflammation. But if I do it fast enough, I really hit it with such an impact, then you're going to see the tissue becomes red. It becomes swollen, correct?
Yeah.
That's just inflammation.
I see. So whenever there's like a tear or something damaged, right, then your immune system will go in and repair it, cause the inflammation.
Yeah,
I
was about to question why immune system, but exactly. Your body's immune system defends you. It protects you. Okay. Most of the time when you talk about immune system you're talking about infections.
Yeah.
The bacteria or a virus and your body triggers, like when we had COVID. Was it the virus itself that's deadly? No, it's the body's response that can be like, like hyper response that can actually be very detrimental to the person's health, right? Right. So you have to understand that the body tries to repair itself. It could be the immune system or it could be cells that are designed to look, something is wrong, let's go fix it. Right? You tear your tendon. Someday the tendon of course you need surgery, but some parts, they can heal. They can heal inside. That's why the human body is remarkable.
Yeah,
it's a fantastic healing
But
machine.
that leads me to this question. Since we are in this topic of inflammation and body healing itself.
Sure.
Whenever we are healing, whether it's inflammation or like a flu infection, right? Like your body, your immune system goes in and heal it. You get a fever, for example, or inflammation, for example, in terms of joints and tissues, right? Do we go in and straight away take painkillers or anti-inflammation pill or even Panadol to subside the fever end the inflammation, or do we let the body heal itself?
That's one of the important components of practicing medicine. Yes, when you have fever, when you have pain, we have powerful drugs that can bring down the temperature.
Yeah.
We have powerful drugs that can stop the inflammation, can stop the pain. But there's a big problem with this. What's causing it?
Exactly.
Have you addressed the root cause? Why does a person have a fever? Right? So you give something like paracetamol, a drug that can reduce the fever. It only works for 6 hours. What happens after that? What if this is an infection that's really dangerous, that's causing tissue damage, and we are hiding it, we are masking it? That's why diagnosis is important. Not just in medicine, in everything. You need to know what's the primary cause, what's causing this, and address the cause.
Because a lot of time when you go and see a doctor, or even our parents or our belief, how we were taught, whenever we have fever, first thing, take a Panadol.
Of course.
2 Panadol. Or even
I
the
mean,
doctors will subscribe you with paracetamol. Right?
because symptom relief is very important.
Yeah.
I mean, a patient comes to me and I say, oh, you're in pain, you're having fever, never mind. You continue with that. We need to find the cause. The patient is going to go, look, I really feel terrible right now.
Yeah.
How long are you going to take to find the cause? No problem. 1 week, take your blood, send to the lab. The lab will do the culture and everything. We find the bacteria, we give the right antibiotic, boom, you're going to be okay. The guy's like, dude, I just want to get better. I need to go back to work tomorrow. Right? So symptom relief is important.
I see.
It is important. So we have to balance it out. If I know what's causing it, I say, hey, listen, what happened? Oh, yesterday I just came back from a flight and people were coughing and so on. I just have this uncomfortable feeling. Okay, most likely you caught a viral infection. You still can drive here. You're not like, so incapacitated. You have a fever, it's uncomfortable. Go ahead, you take the paracetamol. I don't think you need antibiotics. Just maybe take a day or two of rest. Right. So we have to identify the cause gene. That's very important. Right. So yes, we do treat the symptoms of pain. We treat the symptom of inflammation, but bear in mind, we need to find out the cause.
I see.
If the cause is benign, fine. But what if the cause is something serious?
Right. Because right now, learning about this, I start to not take Panadol or painkillers when I'm like having a flu, I have a fever. I tell myself, okay, I'm not going to take Panadol. I'm going to let the immune system fight out the whole thing.
There are many
Without
people who
feel.
believe like you, and
I don't know. Is it true? Is it right? That's what
I can't
heard,
say it's
right?
wrong because sometimes,
Theoretically sounds right.
there
right?
is the field that says that if your body has this particular symptom, it's because it's trying to heal itself. That fever is there to heal the body. So some people believe, no, let the fever run. You're going to get better, which is true, isn't it? Most of the time, it gets better with time. It gets better. Of course, if the cause is something serious, like dengue infection, and it's just not going away, and then the thing happens, the inflammation is such that you're losing fluids,
Yep.
right? You're bleeding. That's trouble. So you need
Right.
to seek medical attention, urgent medical
Right.
attention.
Interesting. So back to arthritis.
Yeah, sure.
Rheumatoid arthritis, osteoarthritis, osteoporosis.
Okay.
What are the differences
So-
between all of them?
And let's talk about rheumatoid arthritis and osteoarthritis, which helps explain everything very well.
Okay.
So osteoarthritis is the one that we are all very familiar with,
Yeah.
the so-called old people disease. Are old already.
Even young people.
But
young people
nowadays,
suspecting
even young
that
people.
they have it now.
Exactly. So we believe that osteoarthritis, the age is coming, they're coming younger and younger. So 80-year-old comes and says, look, my knees are hurting, my elbows hurting, I find my wrist very painful. And then what we call the distal interphalangeal joint. So if you allow a bit of technical term, this is your hand, right? Your wrist, and what we call the metacarpophalangeal joints that connect the hand to the finger. And then you see this is your proximal interphalangeal.
Yeah.
This is your distal interphalangeal, proximal, distal. So the distal ones, if you see in someone who's 70-year-old or 75 years old, they tend to be swollen.
Right.
They tend to be quite bony. And when you touch, you go to your grandparents, say, hey, what is this? Oh, I've had it like for many years. That's osteoarthritis.
Oh, okay. Okay. Because my family, like my dad's side, my aunties, they all have this very bulging like knuckles and
Correct.
stuff.
So
yeah.
we have names for it. This is a Bouchard's node and there's other ones Herberdin's nodes.
Okay.
So these are generally painless. They can be pain. They have pain in the initial part, but they'll just shake their hands, so maybe take some Panadol, they get better. But years later, you can see like it's swollen.
I see.
Right. So that's so-called knotted fingers that they have. So that is osteoarthritis. That's degenerative process. That is because like a car, like any machine, with time, with repeated use, the surfaces start to initially they were separate. There was nice lubrication. The lubrication's gone.
I see.
The synovial tissue, which is the surface that covers the joints, when they face each other, they are not able able to produce the liquid as much as they do, the lubrication is gone. And the space goes, and now they come into contact. When they come into contact, the growth's a bit different. That's when the nodule forms. So that is degenerative joint disease. And okay, the way to look about it, and as scary as it sounds, any woman above the age of 65 already has osteoarthritis of the knees. So, and what they do, you know, the one where you put your hand on your knee and you start to flex and extend, you hear a crack, crack sound. I probably have that. Well, yeah. So that's called crepitus, and that is a marker that this person has osteoarthritis of the knee. What can you do about it? The short answer is, you want it to get better, do surgery.
The kneecap replacement or something,
knee
right?
replacement surgery. Yeah, total knee or
So
knee
there's
arthroplasty.
no medicine, there's no... You have to
There
do
are many
surgery.
people who are going to argue with me. They say, hey, you don't have to go that way. There are medications, all these supplements. You have that. If I'm allowed to mention stuff like glucosamine, chondroitin, and so on, you take all of this, you're going to be fine. I have to be very careful and don't give people false hopes. It works for some. It doesn't work for many. And there's also the placebo effect. And it's $1 billion industry selling these products. Okay, but the reality is, the science of it is that the degeneration is going to happen. Okay, it's entropy, second law of thermodynamics. It is going to happen. So there can be, like, people say, oh, you're having this joint. Come, why don't you take this? Your joints are going to be fine. Well, I mean, you have to do clinical research for that, right? Clinical trials. So if you look at companies that promote this particular product and say, hey, this works, that's the company that produced the research in the first place.
Right.
And you understand about placebo effects,
Yeah.
right? So this is the degenerative disease. Is it something serious? It can be, but by and large, don't worry about it. There are other ways to deal with this. And I think you're going to talk about that.
Yeah.
Yeah, you're going to talk about
Yeah,
that.
we're going to
Okay.
talk about that.
Right. You're going to, the other ways to deal about it. And life-threatening? No. I would really say no. There could be some people look at it, yes, it could be, but that's like overthinking it. But generally speaking, let's just be calm, be patient. There are ways to overcome it. Nothing to worry
Just
about.
sit down and don't walk.
Yeah,
Don't do anything.
we'll talk about all the exercise and so on. The
Right.
other one you talked about, rheumatoid arthritis. Now, this is a group of disease that has to be addressed the moment a person is diagnosed with it. There are certain symptoms that come with it that tells us that this is rheumatoid arthritis. It's an autoimmune disease. The autoimmune disease is because the body's immune system now is triggered to now attack the joints.
Just
Right.
like an allergy.
Like what you talked about is the hypersensitivity response. There are 4, maybe 5 types. So this is one of those that is a slow burn, you know. It's a slow burn. Like I walk somewhere and there's some dust, I sneeze, right? I may have some rash, but it goes away. But this doesn't go away. There's a process that's going on that's slowly eroding and destroying the joints, causing what we call, among other things, secondary osteoarthritis. Remember, we were talking about osteoarthritis, but this rheumatoid arthritis and many autoimmune disorders, that is the fallacy that's going on there. Oh, autoimmune disorders like these are old people. No. Majority of my patients are between the ages of 20 to 45.
Oh, really?
Oh,
Wow.
so young.
I would say 75%. Autoimmune disorders tend to affect younger, not the older age group.
Wow. Okay.
But they do affect the older age group because logic tells you that as we grow older, if mechanical structures can go haywire, even the immune system also, with time, maybe they get tired. They may be tired of protecting all your tissues and suddenly they just let go. And now there's an autoimmune process going on. But it's somewhat controllable, right? But by and large, autoimmune disorders, most of them are diseases of the young people. And it tends to actually, I mean, all men and women do get it. Women get it a bit more. Right? So there's something within the environment that actually causes a risk of autoimmune disorders.
I see.
And there are many autoimmune diseases.
Yeah.
Yeah, there are many. And I do get people coming to me and say, Doctor, I've just been diagnosed with autoimmune disease. Okay.
What autoimmune?
Yeah, exactly. It's like you can, from head to toe, your brain, the eyes, the kidneys, the lungs, the heart, even your skin, the joints. There are so many. The nerves, especially muscles, they can target anything. Right? So anything. So one particular.
Like allergy, autoimmune, for allergy, skin, like sneezing, those are pretty common. But
Those are common.
Rheumatoid arthritis, is it common?
It's not common.
It's not common.
You would say that I see it in 1% of the world population. We see it
okay.
by 0.8 to 1%. But actually, you say 1% is quite a lot already.
Yeah.
If you just talk about Malaysia and 1% of Malaysia, that's already 300,000 people, can go up to 500,000 people, right? So that's actually quite a lot. But
Yeah.
1%, if you look at it in the bigger spectrum, probably not. But it's enough for me to see that I can have 7, 8 patients each time I have a clinic.
Like one in 100 people
Wow.
have rheumatoid arthritis.
Probably, I don't think I'm not a maths person. That's why I'm in medicine. But yeah, we probably have to look at it. Yeah.
Right. And you said it's life-threatening.
Okay, so rheumatoid arthritis, when a person was diagnosed with it years ago, say 40, 50 years ago, it's not life-threatening to say that it's going to affect them in 2 weeks or 1 month. It's one of those diseases that because they slowly lose their ability to move their joints, it becomes deformed, they become very static, they find difficulty in walking, they ended up lying down in bed, and half the time they get into an infection, a pneumonia, and that's it. So mortality rates are increased in people with rheumatoid arthritis in the past, not today. Today we have fantastic medications. Some of them are actually quite cheap that you can get them to. So the diagnosis has changed. Well,
I
the
see.
first thing we tell people, yes, you've been diagnosed with rheumatoid arthritis, but look, you can lead 100% normal life because we have medications now. We also have modern, new designer medications, but maybe you don't need that. We can get you by with just basic medication, right? So
I see.
to say life-threatening may be a little bit too dramatic now, but yes, it has to be addressed. It can cause problems.
I see.
Autoimmune disorders need to be addressed.
I see. Interesting. But there are cures for it right now.
Right now, thankfully, we can address them. We can, okay, I would like to use the word cure. We wish we can cure. Cure means you give the medication, you do whatever, you never see the problem again after you stop the medication.
Yeah.
Unfortunately, these diseases need medication for a very long
So
time.
it's a
So
a
more on the
lifelong.
I mean,
Prevention.
so you said prevention.
Yeah.
But once you're diagnosed, the question of prevention doesn't come in. You can't prevent the disease.
It's
So that's-
lifelong treatment.
I don't want to alarm people to
certainly.
say it's lifelong. I'm one of those who are optimistic. And I say, if you follow the protocols, if you work intensely, perhaps there'll come a day when you don't need medication.
Okay.
I'm quite optimistic.
I see.
If we address it properly in the beginning, then there will come a day then probably we can. And I do have some patients who actually, I'm asked them, have you taken your meds? No, doc, I've been fine last 3-4 years. Wow.
I think we'll get back to rheumatoid arthritis in a moment.
The other one you mentioned,
Osteoporosis.
Okay. Now, osteoporosis, okay, this one, surrender. This is, and with all due respect to people who are in the older age group, I'm one of them. I'm in my mid-50s. So I would say that this is a disease that, yes, happens as we progress, as we grow older.
I see.
But what is osteoporosis? Porous, that means the bone is now no longer the solid structure that it used to be. Now, bone consists of a lot of calcium minerals, that's the strong thing that from, calcium carbonate, what a strong structure it is. But as we go through age, it becomes not as strong. There's not that much calcium. There's not much vitamin D that's causing your bone to have the foundation it does. So it becomes brittle and it becomes something that can fracture easily.
I
So
see.
one fall, or, we have this very common thing where our grandmas suddenly they strip and fall and they use their hand and then they get a fracture there. So that's like, it should not have happened, right? But it happened because the bone is just not as dense as it used to be.
I
So
see.
that's osteoporosis. That happens with age, right? But there are also people who have osteoporosis at the younger group, but they have kind of like severe diseases.
That's a rarer case.
It's it's becoming common because we use steroids. The people who go on steroids, steroids cause osteoporosis.
Oh, really?
Yes. So a certain steroid, glucocorticoids cause osteoporosis. And glucocorticoids are like steroid drugs that are given by many doctors, even in clinics. They are even available in some products that we take, some traditional products. Many cultures use it. And those steroids can cause osteoporosis. So a 35-year-old may end up with a fracture. So, but again, like you said, Jean, you're right, it's rare, but we can usually pick up that they have been taking something that caused them to have the osteoporosis.
I see.
And there are certain diseases that cause osteoporosis. But by and large, osteoporosis is because the person is not taking enough calcium, there's not enough vitamin D, no enough exposure to sunlight. They are maybe nutritionally quite deficient. Women, of course, because women, postmenopausal women are at risk of osteoporosis because estrogen really protects against osteoporosis, right? So this is as we go along. So I think for the purpose of our discussion, we don't have to worry so much about osteoporosis. It's a huge topic in itself.
Yeah.
But by and large, we're talking about arthritis and also with pain and so on. So
Yes.
osteoporosis doesn't, from what I know, osteoporosis doesn't cause pain.
Pain. It's just
It doesn't.
you get injured, you
get
get
injured.
fractured easily.
Risk
if
of
you get
fractures.
a fall,
Correct.
if you get a fall or something. Right.
Yeah, risk of fracture.
Gotcha. So just to summarize, rheumatoid arthritis, autoimmune, attacking the joints. Osteoarthritis is the joint degeneration, and osteoporosis is the weakening of the bone.
Correct. And rheumatoid arthritis is just one of the many diseases in the autoimmune spectrum that affects the joints.
Right.
There are quite a few. There's another one, gout. You heard of
okay,
gout, right?
yeah.
Gout is, in a way, it's an immune, because it's our immune response, but it's because of crystallization. It happens because of uric acid, very high uric acid.
Yeah.
So it's a biomechanical element towards it, right? So, and that can be a very painful condition as well. But as you know, gout can be genetic. It can also be acquired. It can also be because of dietary habits and so on. Yeah. So that's another joint disease. Yeah.
Right. So speaking about, let's go back to osteoarthritis for a bit. So
Okay.
is it genetic, or is it lifestyle, or is it, just aging?
All of the above.
All of the above.
Yeah. So some people are genetically prone towards developing osteoarthritis. So whatever you do, it's because of the genes that they get osteoarthritis. Lifestyle is also a possibility, that if the person is sedentary all the time, no much exercise, yes, then they can risk developing osteoarthritis. Actually, much of osteoarthritis is also, paradoxically, due to sporting activities. So, of course, there are people who have knee osteoarthritis, hip osteoarthritis. But generally speaking, exercise is a very good preventer of arthritis, but the impact exercises are a problem.
Right.
The high impact one.
Like the badmintons, the basketball. Those,
when you run tennis, for instance.
Those that you need to stamp your ground on the feet. Even
Exactly.
jogging.
Even jogging.
to use the
That's why
knee.
I've stopped running, because my knees just can't take it anymore.
Right.
I can walk, I can do a little bit of run, but sometimes when I actually try to run fast, my knees will tell me, why did you do that?
Right.
So these things may need surgical intervention. Basically, arthritis. You see the orthopedic surgeons who will try and fix your joints. There may be meniscal tear, ligamental tears, and so on. So these things are what osteoarthritis is about, where exercise can induce it. But by and large, we tell people you just need to change your style of exercise.
I see. I think that's where the confusion comes in for a lot of people, that we talk about sitting too long or being too sedentary causes osteoarthritis. But at the same time, when we move too much, there's impact. Also, we cause osteoarthritis.
Correct. So it has to be a balance. So you might ask, okay, why you sit so long? Why do you get arthritis?
Yeah, exactly.
You have to understand, for a joint to be fully functional, the muscle must be also functional. And if you're sedentary all the time, what's going to happen to the muscle? The muscle is going to atrophy. It's just going to
Right.
shrink. And now the anatomy of the joint is affected, because the tendons, the ligaments are all surrounding the joint. And they are now not as functional as they can be. There's some misalignment that happens. So you can't be sedentary all the time. When you eventually do walk, now you're walking with muscles that are not quite prepared. Ligaments that are not
Interesting.
adjusted to the new situation. Now the joints become unstable. Now you're at risk of osteoarthritis. Among other things, yeah. There are other things that happen in sedentary issues. But one of the biggest problems is that being sedentary, yes, it's a huge risk. And I would like to say that somebody can argue, actually, no, but you have to understand, sedentary 10 years ago or 20 years ago is different from sedentary now.
Right.
Isn't it? Sedentary now seems like only then you're going to make your money, you're going to survive, you're going to put food on the table. Because what are you doing? Walking here, walking there, walking around the malls. You need to be in front of your computer. You need to be watching the people who are working in, if you don't mind, the people working shares, watching the ticker and watching going up and down, buy now, sell now, right? All that doesn't happen. Maybe someone has designed it. Maybe you have this new AI that, you can do your exercise and work while doing at it.
Yeah.
A heads-up display.
Standing desks and
A screen that is made by rovers. That the rover is actually in front of you, a drone or something. A drone is like, the screen. Okay, you're right. Who knows? Something like that might happen.
Yeah, glasses.
The glasses, they're there already.
Glasses,
Yeah,
right.
Reality,
The meta glasses and
meta
stuff
glasses
like that.
and so on. Yeah.
Right.
So that's happening. But for now, sedentary lifestyles are very, very common, and we seem to have integrated that into our lives.
I think we're guilty of that, definitely. Like right now, I sit way more than I used to. There's parts of my life in the younger times I sit in front of the computer a lot, and I get a lot of back pain, neck pain, right? Even in my early 20s.
Yeah.
And then I move on to more of management role, which I need to walk around, meetings, things start to get better. And then now back to like computer editing, watching stock market, like you say. And then the pain start to come back a bit, right?
Yeah.
So are those also, if you don't treat it long, like you just leave it be, right? You don't stretch it out, you just let the pain become like chronic, does that lead to arthritis? Like
It can, among other things, but there are also chronic pain situations.
Uh-huh.
So it can cause that as well. Not just the joints, when your ligaments and tendons and muscles are involved, they can have chronic body pain.
Right.
Just discomfort. It's just so uncomfortable. Their experience of life per day, when they get up, oh my God, it's so painful, right? So the experience of pain is becoming something common for all the reasons, Gene, that you just mentioned. So if you look at it, I think our culture has gone such that we are now even have techniques. You know the 20-20-20 method, you've heard about it?
No.
So they tell people in this kind of lifestyle, every 20 minutes,
okay.
for 20 seconds, look at a structure that's 20 feet away. That's the 20-20-20
Yeah, I heard
rule,
about that. No,
right?
not that you mentioned.
Yeah. So see now when you do that, okay, then people remember, especially young people, they like slogans and they like those things. 20-20-20, 20 minutes already. Okay. Can go practice your pickup lines next to your colleague. So who's 20 feet away? So for 20 seconds.
Right,
but
right,
after
right.
that doesn't work. Yeah.
Right.
So
Interesting.
yeah. So we have those lifestyle changes. There are people talking about sitting on exercise balls, right? And there are people say, hey, now we can stand and work also. Have you seen that standing workstations?
Yeah.
So we are trying to be less sedentary. So I think, like you said, maybe it's going to move. You moved through cycles before. So maybe you're going to move to a time when we're all walking and, so we are.
But if you just leave it be, right, to continue that kind of lifestyle.
It's a disaster. It's a disaster. I have patients who come in between their 20s and 30s who come with situations, doctor, I've been diagnosed with arthritis, I've been diagnosed with osteoarthritis, I've been diagnosed with this, and I find absolutely nothing wrong. Then why am I in pain, doctor? Right? Then when you go through their history, then you realize they're spending so much time in their coding and your stack and your Python and whatever snakes there are and so on. It's like you see, when you're so engrossed, the people talk about attention deficit, but when something gets your attention, whether it's your work or the stress, you are going to be sitting for 2 hours until you fix it.
Or probably more than 2 hours.
Or more than 2 hours. And after it's done, now the exhaustion comes in. Your body will tell you, listen, this is payback time. Right? And payback time is pain.
Yeah. Especially right now, the new trend about looking at the phone with the neck down.
So that's a huge topic of discussion now, that people's postures are changing. So where people now are looking down, you just go and sit somewhere and observe, maybe just watch, look at what everyone's doing. Everyone are on their phones.
Yes.
Right? Everyone's on their phones. And I've just gone traveling lately and I see this in Japan. I saw this in India. I saw this in Egypt. Everyone's on their phones.
It's a global thing.
It's a global phenomenon.
It's the same posture all.
The same posture. It's like your entire world is in the phone, and even though there's a world around you, and unfortunately we've seen some horrible incidents where people look in their phone walking down the stairs, and you've seen those horrific videos. I mean, those are reality. We are just so stuck on our phones, and I'm guilty of it as well. I'm guilty of it.
Yeah, we are guilty. I'm guilty of it.
And so that posture, and so the neck problem, so the complaints about neck disease, neck pain has increased. You go to any neurosurgeon. So neurosurgeons handle pain in the spine. Right, they handle pain. Orthopedics do as well. So, but when it comes to pain, neurosurgeons actually, you go to see a neurosurgeon, they will tell you, look, oh my gosh, the neck thing. When they see another case, here's another one. And why? It's because of the way we are on our phones. So they are trying to tell you things like working your posture at work. Make sure your head is at the same level as your shoulder and not in front like that all the time. Not you're leaning down. So the way you work on your keyboards, with your hands in the correct position, the right support. So ergonomic design, they call that. Yeah. All this has some basis. It works. It's necessary. It doesn't have to be expensive, but it is. But much of it is just common sense. You will know. You look at your body, just have a look, spend some time in front of the mirror. Okay, what's right? What's wrong? Okay, so, my shoulders are uneven. Why? It's because I'm always sitting like that. Right? Or my neck is forward. It's like when you look on the side, your body's curving. Many of us have that.
Yeah.
So we can do things to sort of fix. You don't need to get somebody to come in. Just look at yourself. You know your back has a gentle curve, but not too much of a curve.
Yeah. I'm very conscious of it right now. I'm trying to
So am I.
sit as
So am I.
straight now.
Every time I talk about it, live by example. But
as you're explaining, I'm like trying to straighten my
so
back.
tomorrow when I wake up, I'm going to be like, hey, why? Body pain. What's wrong? Oh, I gave a podcast yesterday talking about this.
But is there degeneration of like the neck joint, the back joint, to a point that you lose all your cartilage? And because knee you can do a replacement,
yeah,
right?
aging does that anyway.
Uh-huh.
Of course, there are people who have very bad neck disease, so there's a genetic component to that as well. Mechanical people who have had whiplash injury years back, then you'll know 10, 15 years later they'll develop some problems. But I don't think there are that many people who have developed severe neck disease because there is some problems associated with it, but they are usually fixable with physiotherapy, correction of posture, and so on.
I see.
Well, I don't want to make it sort of alarming that it changes things overnight, but a big part of it is to understand that, yes, if we don't do something about it now, then there's going to be a problem later. You can do something about it. Yeah.
Okay.
So talking about something about it, right? Is it diet and daily activities will affect all the joints on the body?
Correct. Okay, let's talk about diet.
Yeah.
The important thing about diet is we have food for nutrition. You need food for energy. If I say that, okay, the tons of food that we are getting now is not good, I don't want to eat, you're just going to starve. You need something. Your body needs nutrients to form the muscles, to form the skeletal structure so that you can function, correct? But the question with the diet is that we need to analyze it. So for this, the right person will be the nutritionist, actually. Dietitians and nutritionists are the best people to talk about this. But as to whether our diet affects us, yes, it does. It definitely does. I'll give you an example. And for instance, Malaysia, statistically, we know that we are a nation of
Good food.
Food.
Delicious food.
Yeah. Obesity is a problem in Malaysia because we have so much food.
Yeah.
And everyone talks about come to Malaysia. And true, food is just amazing, isn't it? We've traveled so many ways. No way, you come to Malaysia, there's just so much varieties in the food, the deliciousness, the different tastes, and so on. So because of that, body mass index, we stretch the 18 to 24 is normal. Everyone's probably 27, 28, 26. You can tell there are many who are between 18 and 24, yes. But we have a problem. And musculoskeletal issues is part of that problem with the diet issues that we have, right? So the reason being that our skeletal structure can only support so much. There's stress on the body. Fat is also inflammation. Too much fat. Obesity is just an inflammation situation.
Oh, really?
Yeah. When there's obesity and fat, we recognize fat as inflammatory tissue.
I didn't. Visceral fats, you mean?
There's inflammation going on. Yeah, you talk to people who visceral fat as well. Of course, you need fat. We do need. Yeah. We do need it. But there are different types. There's LDLs, lipoproteins, HDLs, and so on, right? And the adipose tissues and all that. Some places you definitely need it. But you mentioned visceral fat. So that's an entire topic on its own, right? So these are all inflammation.
Okay.
Right? So when we talk about pain, we talk about structural issues, there's definitely a causal relation there. So getting the right diet, getting the right BMI for your body height, I think that's absolutely important. Right. So with all due respect, I know now there are certain things that we cannot refer to in all these inclusivity terms and so on. I do have people whose BMIs are way off the chart. Doctor, why am I in pain? What am I supposed to say? It's like,
dude, you're fat.
So it's like,
then you get cancelled. Then
we'll get cancelled. You shouldn't have said that. You have to use your skill to make sure that I can be who I am, and that is your job.
Sensitive. Come on,
you have to be
more
sensitive. I'm like, okay, take this medicine. Then you give them a lifetime supply of NSAIDs, and then they'll come in 6 months later with epigastric pain and they cough out blood, vomit out blood, and now you have to do endoscopy, right? Because they use that. You give them something for the pain. That's among other things. And steroids actually help in pain.
Yeah.
Right? Steroids can help reduce pain. But taking steroids in long term, the one that we call glucocorticoids, that's available in clinics and all everywhere, that we use for an anti-inflammatory with educated users, calculated use, but it's available out there. People can pop those pills in. Then 6 months down the road, 1 year down the road, they have diabetes, they have hypertension, they have osteoporosis, they have infection, they have peptic ulcer disease, they have cataract, they have glaucoma. Oh, that came out very fast, didn't it? So that's another risk that we have, you see. So it really goes back down to that person to say, if this is causing the problem, let's get to the root cause, that we need to get you to the correct BMI. You'll find that it creates so much relief. That's not to say that thin people
don't have issues.
They can have issues as well. But it'll be easier for us to narrow it down. Yeah, you can easily, we have ultrasounds, we have MRIs, even clinical examination. We can actually pinpoint the problem pretty easily.
Yeah, because the weight puts so much stress. The extra weight puts so much stress on the joints, right? Especially the knees, the back,
the hips, the hip joints, the hip very joint. Sensitive.
I see.
We always forget the hip joint. The hip joints can be very sensitive to this.
I see. So now that we cover sedentary, sitting down, on the flip side, overactive people, jogging, badminton, basketball, should people stop doing that?
Right.
Or can we continue in a way that is preventable, having arthritis in the future?
There's a saying now, pathology books. There was a time when some research came out and said drinking wine every day is good for you. Now they've debunked that. But they want to say that with all the science that's available, that's supporting all this, not just wine, other nutrients and all, just remember one thing. It is the joggers that will inherit the earth.
Right.
It is the people who are physically active, the sports people who are going to be the most powerful people around. So let's get that fact correct first and then come to the next part, which is, what about the people who are involved in sports? Now, what happens to them? I can tell you that most sports people, because they are training every day, they are building their muscles. They are doing strength training. They are waking up early. They're making sure they're getting good sleep. They're getting the right amount of food. That is why they can do what they do. In tennis, the speed of the ball is just unimaginable. What they can do with it. Like, let's say I see Pearly and Tina, I see Izudin or Aaron, the way tomorrow I want to play. I start and see what. Obviously, I'm going to get injured. Right? But this is what they do. Our sports people
their body conditioned.
So they've conditioned, exactly. They've conditioned the body. And that very act of conditioning your body, training for it, doing your weight training, your strength training, and then getting involved in activity is fine. They will live very good lives. And they will give very good lives. Their health-wise is going to be good. They probably will age gracefully, more than I can say for myself. The writer Haruki Murakami. I think he's a very famous Japanese writer. His work has been translated into translated. Some of them are really hit novels. He wrote a book about what I talk about when I talk about running. He is 76 years old and he runs even today. He either does 10 kilometers running or he's swimming 1,500 meters.
Wow.
Till today, right? And it's pretty amazing. And he says that it's this running that keeps my brain active. And that's why I can produce these amazing works that people are reading. And, I remember being so impressed by his tactic and then realized that sports is such a big component. So anyone who's involved in sports, fantastic. And the reason is the way they go about it. They're not starting it tomorrow or next week or somewhere. No one's an overnight sports phenomenon. They are all working at it, which is something we can do as well. I mean, like I saw the pickleball court in front. Okay, I'm going to do pickleball. Guarantee I'm going to end up in the clinic 2 weeks from now because I did something that I never used to do. And I'm seeing that as well. Doctor, I just started pickleball. A 54-year-old woman came up to me and said, Doctor, I just started. Now my knees are hurting. I said, that's your diagnosis. I said, well, you didn't warm up. Did you stretch? right? So these things are important. I don't know if you all go into your, which you do, I'm sure you do. When you open your YouTube, have you seen that Tai Chi thing?
The AI,
The AI generated,
one, the old guy with the
oh,
muscular.
do you lift weights? No, I do walking
It's been
Tai Chi.
blowing up.
Yeah, it's like everywhere, And actually, it's right. That strength training, you don't need machines, you don't need weights. Calisthenics, yoga, stretching, these are very important.
I see.
But they have to be done correctly.
I see.
Tomorrow, like yoga is part of my culture, and tomorrow I decide to do one asana, bomb. I'm going to get, my back is hurting. Some of those stretches are unimaginable.
Right. So for sportsmen, athletes, right, they're conditioned to do that. But like you said, the lady who come into you said playing pickleball, that's why her knee hurt.
Yeah.
So normal people like us, we want to go jogging. Is warm up or stretching the only thing we should...
activity, Gene. Okay, then you ask yourself, when did you jog the last? How many kilometers did you? What's your cadence? What's your speed?
Mm-hmm.
Right?
Yeah.
It's like with a vengeance, you decide to do 5 kilometers in maybe 10, 15 minutes. Obviously, you're going to come back like, oh yes, but then suddenly your body is going to be like, oh, there's pain somewhere, and you end up in the bed for like 1 week, right?
Mm-hmm.
So it has to be planned. Right? It has to be really planned. Okay, I want to start jogging. Okay, what are the muscles that are involved? Are you stretching those muscles? Are you warming up? You have to warm up before you jog.
Right.
You have to
But is
prepare your
that
body.
the prevention for your cartilage to avoid wearing off your cartilage? Let's say jogging is bad for your knees.
So technique is important.
Right.
How you run is important. Are you landing on your heel each time?
Right.
Shouldn't you be landing on the ball of your toes? Are your shoes okay? Right? Some people do barefoot running and so on. I don't know. Do we have barefoot running?
I heard
there was a
before, but,
time. It was all the rage. I don't hear so much of it now.
Yeah. Probably it's not working.
Probably, the barefoot running may have caused some problems.
Sounds like a disaster
to me,
but I don't know the science behind it.
Yeah, I'm not sure exactly what's the science behind it, but I wouldn't do it because I need that cushion.
Yeah.
Right? So, and I know that one of the reasons why my knees are hurt is because my technique was wrong. So you need the right technique of running.
Right.
You need that, which is why walking is fantastic. Walking, no problem. What impact you have in walking, especially if you're wearing proper shoes, you can walk. You can walk fast if you like. So I do walking right now, and I do uphill walking, downhill walking. So I come back, I know that I've had a bit of a workout. Yeah.
Because we were involved in the badminton scene as well, especially Steven, badminton content stuff. So always we see badminton players who are training very intensely. They are like skipping forward to save the ball, smashing. I always look at, man, their knees is going to be so screwed up. But
absolutely, I would.
Yeah.
And so why I'm now going to disagree with you, respectfully, because I've met some of them.
Yeah.
Okay, they were referred to me because, hey, do they have arthritis? Actually, no, you're right. But the thing I noticed, the muscle, their quadriceps, their hamstring muscles are perfect, anatomically perfect. So they've built it up so well that I know they can take the impact.
I see.
They can take the impact. Right? So, because look at the muscles. It's like, wow, he was like, there was not an ounce of fat in him. He was like perfect. I can even see the fibers to his skin. That is how he looked like an android, man. He looked like a cyborg. It's like, whoa, look at this guy. It's like, and you know that they've worked on the muscle and the tendons and the ligaments. That is why they can handle it. That's why. So there's a lot of research, or rather, there's a lot of work that goes into it. Yeah.
So muscle actually plays a very important factor to
very
hold your joints, your bones together to avoid like the impact on your joints.
Exactly.
I see.
When the muscles are good, you can take the stress away from the joint. So one of the exercises we teach people who have knee osteoarthritis is quadriceps strengthening exercise. So we strengthen the quadriceps. That's the thigh muscles in the front, and the back is the hamstring, right? Mm-hmm. So we actually strengthen that, and it works. Many people say after we do that exercise, our knees are better. Yeah, the pain is much less, right? So that's why strength training, building up muscle. I mean, you don't have to be like a bodybuilder, but just make sure your muscles are toned.
So that's true for every joint in your body as well.
Every joint, and if you're preparing for any sport, yes.
But then muscle is a very critical,
it's absolutely important. I mean, it's our evolutionary. I think the gift of evolution is that we have these amazing muscles that work in an upright position. Right? We are not on our fours. We're in an upright position with a brain. So you can understand that we are like the peak of evolution, right? Yeah, you have the perfect framework for a structure. That's why when you look at I mean, you look at Boston Robotics, they are designing all these dogs and there's dog structures and so on. Yeah, but it doesn't beat the fact that there's also the humanoid that you're starting to see. I think Elon Musk is working on Optimus, I believe it's called.
The
And-
new AI humanoid.
And I believe in Korea and China, they're working on housemaids, people who, the structures that will come and
Yeah.
help you with your housework.
Yeah.
Yeah. So that's the way it's going. It's in the end, it's because the structure, the skeletal structure, the muscle that gives you the ability to have seamless movement. You know, like your hands, especially the kind of movements that you have with your hand that you don't see among primates or any other creatures, right? That's the ability that's given. It's all muscle. So the importance of muscle is very, very important.
What about repeating impact? Like, for example, playing golf. Like,
Yeah.
you hold a golf stick, right?
Right.
You hit balls and balls and balls and balls. Does that cause degenerative in the joints? Or
That is called RSI, repetitive stress injury. So, which is what you're doing. And sometimes you forget the pain because you just want to get that shot, correct?
Yeah.
And that sound, that satisfying sound that you
Yeah.
get because you moved everything correctly. So that's how invested you are that you forget about your body.
Right.
But later, your hands are going to tell you, your knees, the way you
Yeah.
swing your hips, they're all going to tell you, payback time. There's going to be some pain. So that is why even for that, you need to prepare.
Right.
There are exercises, there are ways. Okay, if you're going to do this, or what about taking rests in between? Right?
And proper techniques as
The
well.
proper technique is very, very
I see. So there are ways to avoid this because a lot of layman people who see athletes or whoever doing certain sports, this guy is gonna pay back, maybe later on in his life.
Yeah,
but if you do it correctly, there's
exactly.
actually
That's
ways
why
to.
it doesn't happen. I mean, if you talk about your golf greats, have you heard of them having these issues? No,
Right.
because they work on their technique.
Right.
And one of the important points is how you avoid injury. It's like football, for instance. Now, let's say I suddenly am a goalkeeper, right? The ball is coming at you and you save the ball, and the way you put it, you just hold the ball like that. What's going to happen? You're going to injure yourself.
yeah.
There's a tactic towards
to
it. There's a technique, the way you curve your hands. You can punch the ball, of course, but if you're not prepared and the ball hits you, like you're gonna have tear some things, let alone fracture some bones from some
Right.
joints.
Right.
Yeah. So therefore, technique is very important.
I see.
So we tell people, if you're involved in sport, good for you. Make sure you get it correct.
But is that always like, because sometimes it's like just casual players, I just want to play casual. Do I every time have to understand how do I play this? How do I play this?
I think for
Is it-
longevity purpose, you have to like according to what you mentioned, if you want to play that sport for long term, not professionally but just for leisure, but long
Yeah,
term,
so-
then you have to be aware of this kind of stuff, right? The technique, the stretching, the building the right muscle, so you can play this game for a long time.
Yeah, I think, Stephen, you brought out a good point, because with all the information that we are getting, suddenly the sport is very famous. I don't know if you guys are too young, but there was a time when wall climbing was all the rage.
Oh, yeah.
Everybody was doing it.
Yeah.
Yep.
That friend that you knew for so long, suddenly he's up like 30 feet up in the air. Hey, you must try this hanging and so on. And was he a casual climber? I guess at that point he was. But, when you do, as a casual, as a person who does it once in a while, you have to understand, what is your definition of casual? What you want to achieve? Okay, badminton, I want to kind of smash and turn around and turn around
Like-
3 times
like
and
Dato'
smash
Lee
the
Song
thing.
Wei.
And then, how Pearly can just put a hand behind, hit the thing like that. I mean, if I suddenly do that, that's casual badminton. Who knows? Right? I just decide to go and play. And, okay, I'll tell you an experience. I mean, I was practicing throwing, and I was throwing banana peel. And I was how far I can throw. I threw it. That was 2 months ago. I have pain till today here.
Oh my God.
That one time I decided to test and see how far I can throw the thing, right? And here I am, my friend, hey, why are your hand like that? And want to play the touch and go. So, very painful. Well, so you understand. So that was a casual experience for me.
Yeah.
And look at where it got me, right? So it's a definition of casual. End of the day, Stephen, it's like, you want to do something, make sure you prepare for it. I used to do wall climbing. But if you ask me to do it now, I think being a doctor and at my age, and I realized that I'm not as strong as I used to be. If I suddenly try to reach for one grip, that and it's too high and I go too fast, I might tear something.
Right.
You know,
Right.
and that's one injury up there, and then from then on your belayer gets confused and boom, you're down. So you really have to prepare. You must do your groundwork. Yeah, so that's why when suddenly something happens, hey, come on, let's all do. Wait, take it easy. It's okay. It's all right. No, you're not going to lose anything if you don't do the sport. You must know yourself.
Yeah, because sometimes like friends like want to adjunct you, like go to like pickleball is like very
Because everyone's doing it now.
Yeah,
but I think it's fine. Maybe if they've done their warm ups and so on. But I have a feeling if I go and do it, something's going to happen because I didn't research it. Right? So we have to be very cautious.
So we have to be prepared. Understand. If you want to go into it, then learn from it.
Yeah, I think if you're teenagers or you're 20 something, even your early 30s maybe, but. And with all due respect to anyone in their mid-30s, your body will start...
I feel it.
You will start feeling some changes.
And the funny thing is, like, I love to play golf, and golf is not as vigorous as, like, say, badminton or pickleball, right? Because you stand and hit the ball. And then I never play badminton for a long time, and when I went and play pickleball, definitely use a lot of muscles that I have never used before for a long time. Correct. And I feel the stress, the strain on that.
Then did you, like, everywhere pain?
I felt definitely in my butt cheeks, right? Because sometimes you need to stretch
right?
So that part I haven't used for a long time. So I definitely felt, if I push it a bit further, I'm going to tear something.
So you're a young man, Gene. Imagine if I have the experience, I was like, what's the cause of this pain? I'll go through the entire list. Oh no, this doesn't look good. This doesn't look good. Autoimmune, oh my God, degenerative, and when it's degenerative, you already... I'm halfway there this is not going to get better.
Yeah, right? I mean, I'm 39, not that old, but not that young either. I definitely feel the aging effects playing in from your 20s to your 30s, now moving to 40s. Definitely feel a lot. I mean, but is that normal for people?
That's normal. Look at footballers. I mean, of course, I think when I was in school, 28, 29 was already considered very old already.
Yeah.
Now they can go up to, because... So one of the things that's happening, if I'm not mistaken, I hope I'm getting my facts right, sports scientists, if I'm wrong, please tell me I'm wrong. But I think we are starting to see sportsmen, people in football older, 37, 38, and they're still playing professionally. Now that is part of the improvement in our sports science. It's someone who's older, like can actually be as fit and powerful as someone who's 22, 23-year-olds, right? Because much of it is like, there's a certain peak involved. So we are, but again, it is because of our scientific developments in sports. Sports scientists are some most amazing people, the things that they can tell you what the human body can do, what you can prepare the human body for is just incredible. I mean, look at Formula One.
Yeah.
The amount of stress those people go through. Don't tell me it's a GP settling all that problem for them. No, they have scientists on this. They are physicians, sports physicians who are to the point that, I was told that Formula One drivers have like bigger necks, because of the G forces going on. See how the body changes, right? So it's absolutely important to understand our human body is dynamic. It's never the same thing, right? But it has to obey certain rules of adaptability. It's like, if, let's say, free diving. Let's give an example, free diving. You think I can do free diving now? I can hold my breath. Yes. Maybe I can hold my breath for 1.5, 2 minutes, 3 minutes. But you ask me to free dive, I've never experienced it, right? So you have to train. So that's the important understanding about our...
I think we covered like a few methods to overcome this. Strength training, building the right muscle, the right technique helps. But what about stretching, before and after especially? How does it help?
Yeah, that's the warming up and cooling down.
Yeah.
So the reason it all has to do with vascularity. In order for a muscle to function properly, it has to get the blood supply. And when you exercise a muscle, the blood supply increases. Right. When the blood supply increases, there's more oxygenation. When there's more oxygenation, the muscle functions better. So that's why you have to do that. All right. You have to do the warm up. And one of the warm ups involved, you notice, is stretching. Stretching the muscle gives you more space, gives you more flexibility. What was not flexible now is flexible. So that's why stretch is important. That's why yoga talks about stretch, because you maintain a sort of a stretched position. have you noticed it's not easy,
Yeah,
you
it's not
have
easy.
there's something called the core strength. And that core strength is something that's we know now is a fundamental point of our existence, actually. Right? So yoga talks about that. Of course, the yoga aficionados, the yoga experts will tell you much more about that. So that stretching is absolutely important. You see that why people who do yoga, people who do Tai Chi are very flexible people. They literally they glide when they walk, right? Then after the sport, you have to, basically what you're doing, you're stretching again, just that because now the muscles have been worked. The muscles undergo a certain degradation and they are deprived of oxygen. So one part of sports when you do is because your breathing increases, your blood supply increases, you try to give as much oxygen to the muscles, but at some point, fatigue starts to set in, right? So that stretching is again giving space for the muscles that have undergone this degradation to recover.
I see.
To recover, to go back to what we call as normal.
I see. There was one point of time people saying, especially like gym bros, maybe the bro
Gym
science,
bros.
the bro science. They talk about stretching. Don't stretch before you work out. It gonna
Right.
makes you're gonna injure yourself even more. So don't stretch. Maybe
May
it's-
not be something I'm very aware
Yeah.
of. I remember I used to do some stretching.
yeah, me
you know,
too.
because,
Me too. Yeah.
Because you're going to lift a weight, man, and
Yeah.
that weight is going to keep some stress on your body,
Yeah.
especially when you're doing your squats and so on. Especially when you do squats, when it's so heavy and you lift up, you can feel your one spine talking to the one vertebra talking to the other. Bro, are you okay now? Are you okay now? Yeah, I think I'm going to sleep. But no, it's okay. No, lucky that you've built that erector spinae muscles prepared for it. So I think if for me, I believe some degree of preparation is important. I think it's up to the professionals to tell us don't stretch, but you have to do something else.
Yeah.
There's
They
no
talk
way.
about warming up with lighter weights rather than stretching. Because stretching,
Right.
you might get injured even more. I don't know what's the sign behind it, or is there any facts to prove it, or is this pro science?
Yeah,
or-
I mean, lighter weights, you're just making the move. But again, what are we doing those movements for?
Yeah,
Are you,
to warm up.
there are a few types, isn't it? You do the high reps, many reps, but 2 sets or 3 sets. Or you do 6 sets, but slow repetition, slow reps that you want to build muscle. I think it depends on what we are working out for.
Right.
Whether it's cardio or aerobic or whether it's muscle building, all these things are very different. Bodybuilding and so on.
I see. And what about like stretching for if let's say someone has to be sedentary, there's no choice because it's part of their work. Is stretching important?
It's important you do it well. After some time you go like, when you're working in you're typing on your manuscript like 30 pages and you're typing to submit it like in 10 minutes time, you're overdue and you're so stressed and after you tend to stretch because it increases your oxygen into the muscles that are involved. You feel better. So when you stretch, you feel better. It's almost like very relaxing, right? So that's one of the things that we tell people. It's okay. So of course, you can injure yourself stretching. Yeah, you can injure. You stretch way too much
You
compared to
tear
what.
tissue or
Then
something.
suddenly, like, I caught a muscle, especially the scapular region. Yeah, so we have to know our limits.
Yeah, I think that's something that people should be aware of because I think a lot of people complain about body aches, right? Neck pain, joint, lower back pain, but no one actually does anything about it. Like doing a lot of stretching throughout the day, like
It's all. That's why I say daily exercise is good. You remember when we went to school, they say all the stretches that you do, it just prepares you for the day. And just because we are not laborers, not many of us are not laborers, we're all in the office and so on. There's still some stress involved in the office. We are sitting down, we're working on our computers, working in our even presentations and so on.
Yeah. Is there specific exercise for people who are sedentary that you would advise or recommend people like your go-to exercises?
I'm familiar with the 20-20-20.
Right.
That means every 20 minutes, take a break, loosen up, right? Maybe go for a walk or something.
Yeah.
And that could be for, you decide you want to do it for 20 seconds, you want to do it for 3-4 minutes, and just take some time out, get your face off the screen or of whatever you're doing, right? Provided that it's not going to interrupt your workflow. I think that's just the very basic. And I believe that there are what you call, people do some power workouts. Have you heard of that? Power workout,
maybe
like before lunch or after lunch, 10
20
minutes. Yeah,
yeah.
just do a little bit. I think those are fine, as provided that you know what you're doing, you do within your limits. That's okay. But the important point is you're working non-stop. That's already a red flag. There has to be intermittent breaks. And it might even increase your productivity, your creativity, the quality of work you produce might be better. Right? Of course, there are those people who say, no, once I start, I have to finish. Yes, fine. But fatigue can set in, even mental fatigue as well. You're not, your musicians, for instance, the people have told me that when they start learning a new instrument like a guitar and things like that, they fall in love with the process, because when they realize their fingers and their brain are now working together, they feel as if their brain is working on something new, like new pathways are being made. But after a while, it becomes tedious. They lose that. So what they do is they take a break. Just do something else for a while. Then come back to it. Right? So that is an important point, taking intermittent breaks. And then what do you do? If you feel some degree of physical activity that is, in a way, going to increase your productivity, by all means. Yeah. There's no hard and fast rule that you have to do this particular exercise.
Interesting.
If you find one in the YouTube that somebody advises this, why not?
I see. And let's talk about massage then. You have stretching, then now you have massage. Right? Massage is quite a popular thing. Like occasionally people have this maintenance massage, or even when you have a bruise or a sprain, you massage the area to loosen up the tendons or whatever. Is it a short-term solution or is it harmful?
As a rheumatologist, someone who deals with musculoskeletal disease, I can tell you massage is very underrated.
Really?
It is very underrated. I think the work that massage therapists do, trained massage therapists do, is phenomenal. It's important.
I see.
Massage will help with the body, the flow of blood. It helps with oxygenation. It is also really very relaxing. All the dopamines and endorphins and so on.
When we go Bangkok, Thailand, massage everywhere, we have to get a dose of it, right?
Yeah, and I think I see the people quite happy. They're quite fit, right? They do eat. They don't eat too much. Do we see so much obesity there? I don't think so. And I think physically they're very active people. Yeah, and I see this in many of the countries surrounding Malaysia as well. Even if you go to our rural areas, you see people who are fit and so on. Why I'm saying is that one of the factors that's important is how you look after your muscles, how you look after your tendons and so on. So massage actually helps, because it's really the way we actually kind of like giving the muscles the right amount of nutrients and the right amount of oxygen and the right amount of stretch. We talked about all that, and pressure that actually gets the receptors to be functioning optimally. Some massages, after that, they feel tired. Then you notice that
tired,
they feel tired.
I even get a fever before.
So you can see that, okay, this is way beyond medicine. My colleague is going to say, when did this guy do alternative stuff? But I feel that in many of the patients that I have, they actually use massage and even hydrotherapy. Hydrotherapy is used by a physiotherapist. Many of physiotherapists actually give the massage to that particular affected joint. They do fantastically well. All right. So I don't even sometimes need to give medication. Or my arthritis patients who have this problem, they give the massage, they felt much better. But these are trained massage. So massage is a big important in physiotherapy. I think those who do the Standard Chartered run, they know that when they come back, when they return from the run, you see all this physiotherapists standing, massaging the calf. And the professional runners, they go straight to them first, right? It's just to increase the blood flow into the area to aid recovery.
I see.
But there's, of course, that other massage where they really go
like deep
with
tissue
deep tissue massage.
Yeah.
I admit I have no knowledge about that, but I would be, if it causes so much pain, I would be a little bit cautious.
I see.
You just need to actually talk to the massage therapist and say, what's the benefit of this and so on.
But if you do feel some soreness after the massage, it's normal, right? I guess.
I think it's normal, but if there's any bruising or any, that one I got no experience.
But you cannot move the next day, then it's something.
Exactly. There have been injuries. There have been some injuries, some muscle tears and so on. So that's why it has to be really to certified massage therapists.
I see.
And that, chiropractors and massage therapists, their training is a long time. They learn anatomy. They learn anatomy, human anatomy. They learn it. And they have to not only understand, know where the muscles are, understand their function and why it's important for this particular massage. Yeah. So I would recommend massage therapy for everyone. You just go for relaxation and so on. Yes. And even hydrotherapy. Japanese do it very well. They have their onsen, I think.
Yeah, onsen.
They have the onsen and they have the water jet and so on. So we recommend that for some of patients with spinal diseases and so on, the water jet to reduce the pain. Yeah, so it does happen.
I see. So it's actually good to occasionally go for like a massage.
If it is a regular thing, like, once a month or once every 2 weeks,
It's beneficial.
There are benefits. Yes.
I see. And what about massaging injury? Like you have a sprain, you have a bit of swollen. We put, the Chinese medicine or whatever.
So the
ointment, you massage it.
The ointment is
whatever.
actually in a way anti-inflammatory. So that's just to you assume that it's going into your tissue and massage. I mean, the technique is important. The substance that you're using, if you use acid, then you're going to be in trouble.
Right.
Yeah, it's still going to burn and cause things like that. It has to be something that the human body can adapt.
I see. But it's okay to massage like the injury point to relieve, some people say to reduce the swelling.
So that is called recruitment. So what happens, like, sometimes when you hit your head on something, what are you doing? You're straight going and rubbing it, right?
Yeah, rubbing
So
it.
what you're doing is you're recruiting all the pain fibers on the other side. So it creates like a confused circuit. So from this point to this point, the pain fiber is going, the pain impulse is going, but others are coming, kachao. They're disturbing it.
Yeah.
So therefore, that pain goes off because you're creating another sort of pain. You're like confusing. That's called, enhancement, recruitment kind of thing.
Okay.
Yeah, that's why we do that.
I see.
So that's probably the same science behind it.
No, I mean, I mean, maybe this is a bit like Chinese belief or whatever, compared to like Western belief, who maybe you should ice it instead of like massaging it.
Again, different therapies. Some people say that when something like that happens, we make it even worse.
Yeah.
Because that's the body's way of repairing it.
Yeah.
If you're having low grade temperature, we'll increase the temperature some more so that whatever it's trying to kill, we'll enhance the process. That's a feel. But I think, again, it all goes to the training of the person who's doing this.
I see.
Okay, what is the science behind it? The person offering the service must know their job. And you should do your background background check on the people as well. Like surgeons, for instance, a cardiothoracic surgeon, somebody needs a bypass. What are they going to do? Okay, you want to go here, you want to go here, you want to go there, which doctor? You're going to do your search, background search, who's got the best rates and so on, right? Consumerism in everything. Yeah.
So we talk about like some ways to overcome, to prevent or to reduce the risk of getting arthritis, like strength training, building the right muscle, good technique, and also talking about stretching, and even massage can help a bit, right? So those we covered. How do we actually discover, or how do we know that we are having arthritis brewing in our body, in our joints? Is there any signs that we can tell?
So there are different diseases. So different diseases present differently. Let's say, for instance, we want to talk about osteoarthritis. Now, osteoarthritis or any mechanical spinal back pain, for instance, if something happens when you're doing an activity, right? You're feeling fine, you're driving and so on. And then as you are, let's say, walking up the hill, suddenly something happens. So this kind of a pain or this kind of arthritis is usually mechanical.
Okay.
It's usually mechanical. So that means you've done something, right? The pain suddenly, while you're active, the pain comes in.
So it's like a one-off thing.
It could be a one-off thing. It could be a sign that, okay, you have to investigate it.
Right.
All right. You have to have a look at it and so on. So that's the mechanism. The inflammatory pain, this one is interesting. Usually, you're not doing anything. You're very quiet or you're sleeping and you wake up. The joints are very stiff. The joints become really stiff. Right? That's a sign that this is an autoimmune inflammatory process.
I see.
Or an inflammatory process, right? And therefore, this will tell you that this is a different type of arthritis. That's a different type of arthritis. Something is mechanical. This one looks like there's a disease, right? So this tells you that, yes, there's something going on here. Obviously, the signs that something's wrong with a particular joint is, number one, pain. That's why I say pain is as much as we don't like pain, pain is just a way of our body to tell you that you need to pay attention to this particular part. All right? And pain is by far the commonest symptom that alerts you. The other thing could be a swelling. Like people have, without any pain, they say, why is my joint a bit swollen? So if that's swelling, that's already something that needs attention already.
I see.
Right. Another thing is, of course, any skin lesions that appear on the joint, any redness and so on. Usually that is by the skin, but sometimes joint disease can tell you that look, there's something wrong here through this kind of redness or some inflammation, some pain, warmth,
Right.
warmth and so on. One very interesting thing to talk about is, dengue and certain viral diseases and so on. Joint pain is a very common symptom. Even before they get the fever, they're already having, what's all this pain?
Yeah. I thought that was like a part of fever.
Like, so, but before, sometimes, why my body all is aching and so on. So the reason for that is, the joint, sometimes we call it the powerhouse organ. Why? Because there are many types of cells in that small area. So there's something called the synovium. If we look at the anatomy of joint, you have the bone, you have the capsule, you have the ligaments, and you have the space. But lining the space is something called the synovium. That synovium is an amazing tissue because any type of cell, the red cell, the white cell, the platelets, the dendritic cells, the macrophages, the antibody producing, they're all in there. So when something goes wrong, for instance, the virus comes in, they are very sensitive, They'll say something is wrong. They'll start to release their, what you call, certain messengers that tell you that inflammation is going to start.
I see.
The joints, we have to pay attention.
So that's a signal.
That's a signal. That's why, you may not have the fever. You just feel tired. Another one is lethargy.
Yeah.
Lethargy is another way that, yes, you feel abnormally tired. And many people, autoimmune disease, always say, Doctor, I feel tired all the time. But I get that everywhere. So sometimes I feel tired all the time. I just say that. So another thing is lethargy. Inactivity causes lethargy. But unexplained tiredness sometimes can mean that it needs attention.
But how do you differentiate the pain? Like, is it a chronic pain, like every day without even moving you feel the pain? Or when you do that activity that affect that joint, then it's pain?
Yeah, so there are two, it all depends on the fiber. There are, I believe, my neurology, there's a type A and type C. Type A is the one which is myelinated, which means they really work very fast. The moment there is a trigger, it sends the signal up to the brain and say, hey, these are usually sharp type of pain, whether it's chemical, whether it's pressure, whether it's temperature and so on. Those are the type, and you will know.
Like instantly,
you will instantly know,
stop.
whoa, okay, wait, there's something there. The one you're talking about is the chronic, dull, aching pain.
Yeah, you can power through it.
Correct. That's the type C type of, that's a type C fibers.
C.
I'm sorry to use that.
Yeah,
I know what type C.
No, it's okay. I think that's a good way to categorize it.
Right.
Type
So,
A, type C.
Those are the chronic, there's acute and then there's chronic, right? So what happens is that these fibers are a bit slower. Right, they take some. That one is the one that, you have to pay attention. If there's a dull ache, if you have not done any sports or anything like that, that's why many patients with arthritis will come and say, Doctor, my wrist was aching, but I don't remember using it in that way. And it turns out they have arthritis.
I see.
So it's listening to your body. End of the day, it's listening to your body. And yes, it is always okay if you don't know what's happening. Go and search it out. Go and see your doctor. Go and see your GP. And try to talk to them about it. And usually there's a solution. It can go away. It doesn't go away, then go back to your doctor and get a second opinion and get your doctor to refer you to perhaps a specialist who can actually decide that, look, there's something here that needs a bit more attention. And Malaysian system is such that by the time they come and see me, it's genuine. Yeah, there are times when it's too late, but most of the time I say the quality of referrals that we get is quite good actually. Many of the doctors have a high index of suspicion and they come and see me, and most of them I know when they come to see me, and my colleagues, my rheumatology colleagues, we have a fantastic network of rheumatologists in the government hospitals, really. I learned so much from them. And we know already, yes, there is something going on here. You can't just say, hey, take some painkiller and go. Right? The GPs would have done that. But when they refer to you, you know that we need to pay some attention. There's something here.
I heard about one of my friend has this pain over here, like he cannot straighten the finger or something. So I was trying to find out what is wrong with it. It becomes like a chronic pain. And in the end, it was diagnosed because he was holding the phone like this all the time, like all of us, right? We always use our pinky to hold our phone like this.
Correct,
yeah,
correct. Yeah.
And then it became chronic until that he cannot
really?
straighten. Yeah.
So
I was
the-
like, that makes me like, okay, I'm not even gonna put my finger. I'm gonna just hold it.
So this is tendinitis. This
Yeah.
is chronic tendinitis.
Right.
So I think a few of my colleagues have researched on it, on what you call thumbitis. They have the pain in their thumb because not only that, many people are doing this one finger thumb,
Yeah.
You know, the cool Joes are doing that one finger typing. They can do it in one finger. I've seen it. This two is, and most of us are doing two, but some are doing this one. And they report that because of the overuse, they have basically what we call the FPL, flexor pollicis longus, the flexor digitorum longus. They're all, these are not bones, these are tendons.
Yeah.
They look so hard, but you see the way they move is that because there's a lot of lubrication inside.
I see.
But you do it too much that the lubrication is just not enough. It doesn't have enough fluid to come and recover.
I see.
Then you are developing almost like, can you imagine a piston that doesn't have enough engine oil?
Right.
It's just going to get stuck, man. And the friction is going to be really bad.
I
So
see.
they can happen like that.
I see.
So it's really vigorous activity.
And that is not arthritis, as tendinitis.
Tendinitis.
Right?
Tendinitis.
Right.
We also have something called enthesitis. Enthesitis is where your tendon gets attached to the bone.
Oh.
That area can get inflamed as well. So that's called enthesitis. Enthesitis, it's a bit like, people have Achilles tendinitis. Yeah, they have that, and they have plantar fasciitis. So these conditions all are definitely chronic situations that need attention. It could be an underlying disease as well. So that pain can be a bit difficult to describe, but we pick it up and say, hey, you have enthesitis. So we need to see why you have enthesitis. Tendinitis can be like, so much of repetitive stress injury could be tendinitis. But tendinitis could also be part of a bigger disease. So we have the experience, we have the knowledge to differentiate that. We are orthopedic surgeons as well.
I see. So let's touch a bit about rheumatoid arthritis. Go back a bit because I think autoimmune is something that is quite tricky, although it's rare, but it's quite tricky. Like, how do you actually detect that early stage of rheumatoid arthritis?
Okay, so we are along with rheumatoid arthritis, there are many other arthritic diseases. One of it is lupus. Another one is psoriatic arthritis. Another disease is seronegative spondyloarthritis. All these are diseases that are different relatives. They're kind of like the same, but they're relative. So like psoriatic arthritis is arthritis. Looks like rheumatoid, but they also have psoriasis, a skin lesion as well. So quite a number of disease. The question to how to pick up the diseases is, in rheumatology, we have one dictum, and that is you only treat when the person has symptoms, right? There are blood tests that we can do. There's something called a rheumatoid factor. 70% of patients with rheumatoid arthritis have positive rheumatoid factor. Right? So rheumatoid arthritis, I know when they say, hey, your rheumatoid factor 300, rheumatoid arthritis.
Rheumatoid factor
It's called rheumatoid factor. It's an antibody. It's an
Antibody,
antibody against the human antibody.
Okay.
It's called rheumatoid factor. And then there are others. There's one anti-cyclic citrulated peptide, anti-CCP. Another one's called anti-nuclear antibodies. So your body produces these antibodies. We know that they produce it well before the development of the disease.
I see.
Well before. But the question now I put to you, is it worth checking or not? Because chances are the person may not develop the disease also. There are about 15 to 20% who have the antibodies for some reason, but they don't get the disease. So it doesn't mean that if you pick up that the rheumatoid factor is positive or the person has a relative of rheumatoid, I give you medicine now so you don't get the disease. It doesn't work that way. There is some research going on. They pick up like a genetic link and then they pick up the positive anti-CCP and then they give the drug to prevent the disease. But again, out of 100 people, maybe 30 people don't get the disease. The other 70 go on to get the disease. So it's still a field that we are not very sure about whether it's worth picking up these cases and saying, hey, let me give you the drug now. But I'm telling you, these medications, while they're effective, they can affect your life. They can affect life. You have to take pill every day or every week. And some of them, we need to monitor the liver function. We need to monitor the blood count because it can drop the blood count, right? When we give these medications. Women can't take some of these drugs because if they want to start a family, you can't. Right? So we only have to treat. So as much as we would like diabetes, for instance, you can pick up if this person has a risk of diabetes, right? You can pick up family history, diet history, body habit, what a certain blood test, fasting blood sugar is a little bit higher than it should be. You got risk. You can do something about it. But many autoimmune diseases, if you pick up that this person has a risk, the only thing we can do is wait. If the disease does show up, then we start the treatment.
But is there any symptom to motivate you to go and get the test for the rheumatoid factor?
It could be very dangerous because we are starting to see this. So whenever people go we were talking about that in healthcare and so on. So nowadays there are so many labs that offer blood tests. Let's say I ask for complete blood count, liver function and kidney function. I only want that. But when we go to the lab will say, you do all this, you do the package lah. And this will cost you 85 ringgit. You just add 10 more ringgit. I can do the whole test for you. Then some of these will come and say, unnecessarily you do a test and now this is positive.
Right.
Gone. The anxiety will start. Doctor, why my rheumatoid factor positive? And it can cause a lot of anxiety. So I wouldn't advise doing these tests just because you're worried you might develop the disease.
I see.
Now, the screening is an important, like cervical cancer. We can screen for cervical cancers. We can screen for even self-breast examination for to prevent breast cancers and so on. And there's some genetics and all going on there. But you have to understand all this has to be done professionally, under supervision, with guidance and with knowledge. Not just a blatant, somebody asks you to do the test and then you check, right? So it's all about knowing your body, knowing your risks and going and seeing your doctor, talking about it and deciding whether this test is worth doing or not. Understanding that when you do the test, when the result comes, you're prepared to accept what the results show. If you're unprepared, it's going to cause a lot of anxiety. Yes, the rheumatoid factor suddenly is positive, but now they cannot get it out of their head. Why my rheumatoid factor positive? Come and see me, doctor, can you give me a medicine to reduce the rheumatoid factor? I say, in order to do that, I have to take out your entire immune system.
But what are the main symptoms that is going to appear first that if you're suspected to have rheumatoid arthritis?
Right. So it'll be when they wake up in the morning, they'll have stiffness of the joints.
So it's pretty much the same with the
arthritis, inflammatory arthritis.
Right.
So they will get up in the morning and say, hey, why my joints are very stiff? And it stays stiff for 3 hours, 4 hours like that. And then there's also possibility of joint swelling. And then there's another possibility that certain diseases, they have rashes that are associated with it.
I see.
And then the feeling of tiredness. And they may take medications to reduce the swelling, but boom, the swelling comes back again. Right? So it's very typical. Every time we see a patient, it's not that difficult to diagnose. The moment the patient comes to me referred, and so they are telling me the same story, the early morning stiffness, and then I look at inflammatory markers, they're high. So it's easy to pick up. I think Gene, what you're looking at is it possible that a person can ignore the symptoms until it's very late?
Yeah.
Can. I have seen people who come in way too late on a wheelchair with their joints totally deformed. Ask them what happened. No, I thought it's normal pain. I think, surely when your finger, you cannot move your finger, it's stuck. You didn't think it's normal? Doctor, I'm working very hard every day. I'm operating machines or I'm on the keyboard. I thought it was a normal thing.
Yeah.
So I've seen that as well.
Yeah.
So it's about awareness. Yeah. It's about awareness, about talking to your friends.
I think that was my question, because some people might think it's because of my job, right?
Yes.
So I get the stiffness.
Yeah.
So how to differentiate whether it's from a job or it's actually something more serious underlying it?
If it affects the quality of your work, that's a very important thing. Obviously, when your hand is so stiff, you're going to have trouble typing. You're going to have the trouble doing basic things. And when it starts to affect, then you realize, look, I think something's not right. And we Malaysians have a tendency, nothing, just live with it. we have that tendency.
True.
We have that. Yeah. And, because you really do not, first of all, the terror, the thought of, oh my God, I'm going to be diagnosed with a disease. I mean, I have that as well. It's like, gosh, is something wrong? Is this going to end up, but we tell ourselves, like that means, don't drive a car. Don't come out of your house. Stay at home. It's safe. You live in life as a human. There are all these problems. Right. We have to be brave about it. We have a courage in life a little bit. So, but when you realize that something is not quite right, speak to your friends. Go see a GP. Go talk to a doctor. This is my situation. And more than often, you can pick up something early.
I see.
Yeah. It's always okay. Some people say, well, little thing also you want. I completely understand that. But sometimes it's really prudent, penny wise, pound foolish kind of thing.
Yeah.
That we deal with things when we have to deal with them. You feel something's not right, just speak to someone.
Yeah. And what about preventing it, like reducing the risk? Also arthritis, we can do things to prevent it. Right?
I've been reprimanded for this because I've had people who came in with autoimmune diseases, and I tell them, look, how many hours of sleep do you get? You try and see, you ask everybody, how many hours you sleep? What time you sleep? 2 o'clock, 2:30, because they're on their phones, they're on their screens till late at night. And then by the time they sleep, 1 o'clock, 2 o'clock, our brain's so wired with visual images. What quality of sleep you're getting. And then you have to get up at 5 o'clock, 6:30. You slept maybe for 4 hours. Out of that 4 hours, deep sleep is how much? Maybe 10 minutes. Right?
Yeah.
So you have to understand sleep is such an important component in the management of autoimmune disorders. It is when we sleep that our body fixes itself.
Interesting.
It's when we sleep in that dark room with no lighting, maybe a little bit, in the temperature 1 or 2 degrees just below what is outside, and no disturbance. And prior to that, you're not exposed to the screen light, right? The screen lights can play with your retina, it can play with the nerves. How many people are doing that? How many people are getting that proper sleep? 6 to 8 hours. They're not even getting that. So you talk about gene preventing, that is one thing. And not only that, helping to reduce the symptoms, reduce the severity of disease. Sleep is one of the biggest things.
Right.
So you can give whatever medication you want. You can give all the 7, 8 medications that are available. You take this pill, you take that pill. But if you're not sleeping,
I see.
don't even talk about autoimmunity, even day-to-day life. Right? The quality of work when you don't sleep, you can see that. That sleep is one of the... Actually, you can solve a lot of problems with good sleep. If everyone's sleeping at that time when they're supposed to be sleeping, it's good. I mean, for me, sleep has never been... and many of my doctor colleagues, sleep was never in our dictionary ever. It's like on call, being on call. You're working Monday night no sleep, Tuesday night no sleep, Wednesday night no sleep. Thursday have suicidal thoughts, and now I man up, and then Friday just go on. But we realized that the value of sleep. The other thing that you can also reduce the risk is to look at the family. Is there a history of illness? Right? If there's history of lupus or history of psoriatic arthritis or rheumatoid arthritis, there's some history going on so that you know what's happening. But just to be aware of it so that you can make the necessity changes to live a healthy lifestyle. Today we are talking about genetically modified foods. We are talking about microplastics. I have a feeling these things, you're going to ask me, are we seeing an increase in autoimmune diseases?
Yeah.
You think we're increasing? What's your answer?
I think so. I think it's increasing.
Yes,
definitely.
you are right. We are seeing more and more cases. Yes, our populations are increasing.
Yeah.
Earth population was 5 billion, now 7 billion, 8 billion, might plateau, but the numbers, but even then you have to understand the quality of our food, right? The quality of fast food, processed food, where our foods are growing, where are we growing our foods? I had an orthopedic surgeon who came in, I saw him coming out of his consultations carrying vegetables, bok choy and kangkong and everything. Can I say, what is this, boss? This one is my patient who's a vegetable grower, says he only eats this. He giving it to me so I have long life so I can look after his family.
Wow.
Vegetables. And he'll tell you all the things that are going wrong with what we are doing to our vegetables and so on, right? Then meats products, dairy products and so on. I can tell you that there is a crisis going on. There is a food crisis going on. Right. And I can only think that it is because of all these aberrations that we're having an increase in autoimmune disorders. So watching what you eat, eating the right food is very, very important. All right. And it's not that difficult. People are starting to grow their own stuff. People are growing their own carrots and onions and eating that. And they're reporting that, number one, the food is fresh. It tastes better. They feel better. So I think that revolution has to start. So the second thing is food. First was sleep. Second thing is food. Third was physical activity, the right form of exercise. The human body is designed for mobility. It is designed for us to be able to run, to be able to swim, to be able to operate stuff within the capacity. What the human body can do is amazing with training and so on. And you look at them, they're all sleek. So physical activity is absolutely important. These three main things are really, really fundamental towards preventing. Look, genetically, you're going to get it, but you can lessen the impact by making the right things, the right steps. This 1, 2, 3, among other things, but talk with this first.
Right. I just want to jump back to the sleep a bit. Maybe it's
Sure,
unrelated to rheumatoid arthritis, but
so there are sleep specialists. Perhaps you can have someone.
Yeah,
and I would love to.
yeah.
I would watch that episode.
yeah, I would love. We actually do speak to Dr. Stanley.
Oh,
Liu,
Dr. Stanley Liu,
who's a sleep expert.
Hmm.
But I'm not sure because you mentioned about sleep with the screen, especially, right? I'm not sure if you are expert on that, or maybe you have some thoughts about
I
that.
have read about it.
Yeah, read
what I
about
know is what I read about.
Yeah, because we are all guilty of it. I'm also one of the biggest guilty of watching my phone till I fall asleep. But what I do is because I can't stop that habit. It's so hard. So I put on the warm light on the screen, and I wear like a warm glasses, orange glasses,
But your
blue
retina-
light filter, blue light filter glasses.
Yeah,
Yeah,
but
I do
you're
that.
sleeping?
To sleep. No, to watch.
So, yeah,
to look at my phone before I sleep. So I put on the blue light filter glass, and I put on the orange, the warm screen, and I put my intensity all the way to like the lowest, so that I can watch it without any blue light coming in. That's actually what I do to make me feel better, so that I don't need to.
Yeah,
put
but
away
your
this habit.
retina is still being triggered. Your retina is still being triggered.
Yeah.
Right? As opposed to reading. All right? As opposed to reading in gentle light. It's still a light source that's coming at you.
Right.
So yes, you are reducing the impact, but you have to understand your brain is already getting wired already.
I see.
And what we want to do is sort of tone down. It's not that difficult, Gene. I mean, just after 9, decide I'm not touching my phone. Try it. Try it for 21 days.
No,
and
it's
you'll
so
find
hard,
that if you do anything for 21 days, after
Yeah,
that
become
it'll
a
become
habit.
second nature.
Atomic
21
habit.
days, after 9, digital. I have many friends who have done it. After 9 o'clock, they just leave the phone. Like if there's an emergency, I just leave that on. In an emergency, nobody is going to WhatsApp you and say, hey, I'm having a...
Yeah.
They're not going to send WhatsApp you in the hope that... And then notifications. I've turned off my notifications. I only know that there's a message that when I check my phone. And the other thing is content. Again, you see, we are absorbing content. This whole absorbing content is... I'm going way out of medicine here. This whole absorbing content is what has driven us now to be the people that we are. And the content is more exciting. The more is content, that's why it's dopamine. It's addiction.
It is.
It's addiction. It's our body has got that connection with that particular structure instead of the person next to you, right? Like I have a connection now with you guys, but what if suddenly there's something on my phone that an interesting YouTube thing that comes up and I'm not paying attention? You see what I'm saying?
Yeah.
But the reason is there's a hit here that is making me feel good. All those likes and so I read that Facebook, the moment you see likes and how that's gripped everyone, it's all about content absorption. I think end of the day, it's about preparing yourself for content creation. And that needs you to be well rested. There's no way you're going to be making content when you're exhausted. Maybe you can, but the subject might be really dark, might be a bit poetic, might go wrong all the ways. But I think important to understand that in order to be fresh, in order to be the person that you feel that your productive value is really, really high, you need to get good sleep. And that content that you're absorbing is someone else's content. When are we going to see your content, which is what you're doing now? You're creating content now, but it's 6:35. It's not 10:30 at night. Right. Yeah. So that's the important thing. The time for us to zone down is absolutely important.
Right.
So you could do whatever you want, but you're losing sleep. You're still awake.
I see.
You're losing sleep. You never know. You just tire yourself out. A nice evening, you do some sports that you like to do, maybe focus on your golf or go for a run, go for a swim. Guaranteed 10 o'clock you're going to sleep already.
Yeah.
You just turn on. You will feel tired. You will sleep and see how you feel. You'll get up so fresh in the morning.
Yeah.
And that's another thing. Waking up fresh. How many of us have that experience where you wake up in the morning fresh? Are you tired when you wake up in the morning? That's a sign of autoimmune disease. When you wake up in the morning, it's like, I'm not just frightened people. It's like you're heading there. Your body is this amazing thing, but you're denying it the one thing that's going to make things fantastic.
I do feel tired when I wake up.
Yeah.
now that you mentioned.
It's like, we feel tired. When you feel tired, when you, instead of waking up, say, yes, okay, whoa, I feel good. Not forcing yourself, literally just, a hangover, for instance. You know what it's like. Sorry. I hate hangovers, man. That was one of the things that actually make me stop consuming stuff that gives you hangovers, is that I just love the experience of waking up in the morning, the sunlight and the view and just the natural sounds to remind you that you're on planet Earth and not on Mercury or Venus or Jupiter. That you're here. It's not your phone, your planet phone. You're not there. It's just that. So that's an important experience. So perhaps going back to the light that you get from your phone, in the end, that light is what you need for the content. Unless you have the Kindle, the Kindle, that one is nice. But again, it's not moving pictures. It's text, right? Yeah. So I think Kindle got it right with that. But who knows? There's a technology that uses paper ink to give you your images and so on. Or the better thing is the thing that you, an electrode, electrode gives you the images. You close your eyes, you can see it already. Your contact lenses or something like that. I mean, I saw Black Mirror, that episode was really scary, man. It's like, again, this need to like absorb things.
Content.
I think that's where we have to, and I dare say, I mean, people are going to disagree with me about this, but this whole content absorption thing, that might be one of those things that's causing disease, right?
I do feel so. The more content we have, actually,
you heard it here first.
Yeah, you heard it here first on the Entrepreneur's Journal.
Absorbing too much content is perhaps a harbinger of diseases.
I do agree. I don't know about disease, maybe because of the sleep, but the more we watch content and learn, the more we don't learn. The more we forget about stuff. That's what I feel about these few years. I absorb so much content, knowledge, learning from all the videos and stuff. But my mind is just so clouded. I forget about things. I lose focus, and I actually lose a lot of knowledge and forget about things that I've learned instead of learning them. Right? If that makes sense.
Yeah. It's a paradoxical effect. You want to learn something, but because there's just so much content that you forgot what it is that you learned in the first place.
Exactly.
Right? And not only that, I believe that the subject matter itself, there are 10 ways to approach it. Like learning a language, for instance. How many apps you have, how many, so on. But what happens? Do you actually get to speak the language the way you want it? Can you do poetry? Can you actually write some? But all that comes in the end with experience with that person. Talking to someone who speaks the language, uses the language, a collective. I don't see a screen being involved in that. Right?
Okay, so coming to the end of the podcast, just a few more questions.
Sure.
And one fun thing we need to do, myth busting. Right. I just fire you a few questions.
Okay.
All this is some sort of like a myth. People might believe it from our parents saying, our grandparents saying, and you just tell us true or false, maybe with a very quick explanation why it is false or why it's true.
I'll try.
Yeah, let's do that. So, joint pain and body ache are just part of aging.
They are part of aging, true, but not just part of aging. They can be a sign that there is a disease that we need to probably pay attention. See your GP.
Okay. Weather changes makes our joint hurt.
True.
Really? I thought it was like a Chinese
I thought this
family.
was fast. You don't need no, it's true. Okay. Do we have a time? Do you have some time?
Yeah,
This
sure.
is fascinating.
Okay.
Before it rains, the barometric pressure is low. When the barometric pressure is low, the joint pressure is low, our joints and tissues in the body actually have a little bit of pressure on them. They exert the pressure outwards, right? A bit like a balloon, there's more tension. The balloon, the air wants to come out, but the pressure is low. The air goes from high to low, correct? Same, that's why the joints can actually stretch. The nociceptors are stretched. So some people report when it's cold, before it's going to rain, they feel that their joints are acting up and the body is aching. It is true.
So the Chinese call it Fong Sap.
Fong Sap.
Right, so it is actually...
I call it Fong Sap. So I'll tell, apa Fong Sap. Siu Fong Sap.
Wow, interesting. Calcium supplement can strengthen and repair bones.
It can. You need calcium. You need calcium for bones. So if you're taking it as supplements, make sure you're taking it as per the body's requirement. We need about 1 gram, 1.5 grams. You take too much, it's just going to be excreted. So it's important to make sure you have normal calcium levels, normal vitamin D levels. Vitamin D, if it's normal, it ensures that you have good calcium levels.
Does age plays a factor in absorbing the calcium?
Yes, definitely. So as we grow older, our calcium metabolism does get affected. So it's important we understand what are our calcium levels. There's a hormone called parathyroid hormone. There's also vitamin D. We need to know these are all in sync, in good values. So make sure if you deny your body vitamin D, deny your body calcium, we're asking for trouble.
Collagen can regenerate our joint cartilage.
What is good one?
It really, my first answer is no. My first answer is no, because you have to understand your body produces collagen. If we take collagen into our body, that's collagen must somehow survive the acids and everything in the intestines, absorbs as collagen go into the joints. I think overall proper diet and nutrition is the one that's going to ensure that you have whatever is needed, your collagen, the matrix, the whatever, the calcium, and a few others, or what you call the building blocks. Okay, so we used to call them, so like, for instance, if you talk about the synovium, you want to talk about the health of the bone, you want to talk about the health of the structural tissues, you need overall good nutrition. But if I'm pumping my body with collagen, I don't know what's happening to that collagen.
Right.
We don't really have ability to measure the levels. So be careful with supplements. All right, be careful with supplements. It's hard for me to say don't take it. Some of my patients do take these and say it works. If it works for you, okay. I'm not going to stop you. And it's not harming your body. It's okay. But you feel that taking it because everybody is taking it, you're going to, you need to re-examine yourself and see whether you need. So be careful. And these products are not cheap, yeah?
Yeah, it is.
They're expensive. They are very expensive. Nothing below 100 ringgit. I'll be surprised if something is 20 ringgit, 30 ringgit.
Yeah.
Your diet can give you all of that. You know, bone broth?
Yeah.
People talk about bone broth.
I was about to ask you the second one.
Actually, I honestly, I have no idea, but apparently it works. So, and yeah, it makes sense to me, because they have all the nutrients in the right way, and people are recommending, apparently skin gets better and so on. I have to, but I wouldn't mind taking bone broth, because you can go to the shop and buy bone broth.
That's exactly the next question. Is drinking bone soup or bone broth can help with joint pain or recovery as well?
Again, I have no answer to this. I'm a firm believer in chicken soup. I'm not feeling well. I go somewhere, go nice chicken soup. I will take it. I feel good. All right. So I don't know the science behind it.
Comfort food.
It's comfort food. I have no idea what science behind it. But yeah, if you feel better, but is it the answer to fantastic nutrition that your bones and joints? I don't know. But it makes you feel good, and you feel that you're getting good nutrients from it, and you're not overdoing it. I think that's fine.
Right. Two more. Cracking your knuckles can cause arthritis.
No, it can't cause. It's
So
irritating.
It's okay
It's
to crack.
absolutely annoying. But when people do that, it's like, okay, why are you doing that? Sometimes I'm like, it doesn't cause arthritis. It's fine. It's just the way the air bubbles are forming in that, and you're just snapping.
Right.
That's it.
Right.
Yeah,
Same for other joints as well.
Yeah, same. When people do this neck cricking thing, that's horrible. Oh my God, that's so scary.
The last one. Women are more prone to arthritis than men.
Okay, women, arthritic disease like rheumatoid arthritis affects more women than men at a ratio of 3:1.
Wow.
3:1. But there are some arthritic disease that women and men are equally affected. Osteoarthritis tends to be a bit more prominent in women. So we feel that a big part of it is because when you talk about arthritis affecting women, the autoimmune disorders, women tend to have a higher risk, but men have it as well. You're talking about osteoarthritis, degenerative arthritis, women get hit quite badly because they have the protection of estrogen for a big part of their lives.
That's
Right?
right.
But once the estrogen starts going out, yes, they do develop increased rate of arthritis.
I see. Okay, last question. If you could go back 30 years younger, knowing everything that you know today, what would you have done differently to keep your bone health or anything in general healthier and strong?
There are three things I can think of. One is make sure I'm doing the right exercises in the gym and doing strength training and building muscle. That's important. Building a good muscle mass, not overly, just good muscle mass is good. You can even prevent osteoporosis. I should have been regular with that.
Right.
Second is diet. I wish I was a bit more regimented with my diet. I'm not. I don't think physically I'm like obese, but I know that my BMI is higher than what it should be. So I should have been a bit more careful with my diet in terms of eating proper food. And third is sleep. Okay, make sure you sleep properly and do away with all the gadgets and so on.
Right.
After 9 o'clock. Before that, do what you want. Yeah.
Fantastic. I think that's a good way to wrap up the whole session.
That's been my pleasure.
Thank you so much, Dr. Guna. That's a lot of useful information and awareness that how people should train, should work out and conduct their daily life, especially those who are more sedentary. And if there's any symptoms, how they should react to it and seek the GP to get consultation.
Yeah,
to get it
there's
fixed.
always help. Don't panic. Living on this earth, there's all these risks involved and all. But just listen to your body.
Definitely.
Listen to your body, and most importantly, respect the body. You have the human body is one of the most amazing gifts that we can have. Just treat it with respect, and it'll treat you well back. Yeah.
Awesome. Before we end, is there any place that people can find you, your work, your lectures, or whatever that you have on social media that people can check your work out?
Or your
Oh,
website.
okay.
Then your website or anything?
I only have an Instagram account, but that's nothing to do with medicine.
Right.
So, and it's more like a
Social-
wannabe travel blog.
Right.
Wannabe
You
travel
do travel.
blog.
You do travel.
I
quite
do
a bit.
travel quite a bit. I should be traveling more, but most of the time you can find me in my Unistimulator Specialist Center website. There's some details about me. And people want to fix an appointment. Yeah.
Awesome. Yeah, we drop that in the description below so you guys can check out Dr. Guna's stuff, or you can book appointment with him if you want to get consultation. But in the end, I think this is a very useful session, and I thank you for coming to the show.
Yeah.
Hope to have you back in the next time.
Sure. Thank you for having me. It's been a pleasure.
Thank you,
Yeah.
Dr. Guna.
Okay.
Thank you.
Cheers, guys.
And if you guys enjoy this episode, make sure you hit the subscribe button, click like, leave a comment below. That would help us grow the channel and bring you guys more amazing guests and conversation. But in the meantime, if you've discovered this journal, don't keep to yourself, share it to the world. Me and Steven will see you guys in the next one. Cheers.
Cheers.